And welcome to our MIPS-SURS presentation on the 2020 quality category. This is one of a four-part series with each presentation highlighting one of the four MIPS categories. Today we will give you a short summary of the quality category, explain the changes for 2020, and tell you what you should be doing now in order to satisfy this category's requirements. Quality is maintaining its 45% weight in 2020, and you must still report a full year of data. To work towards earning the full 60 points in this category, you need to report at least 6 measures, with one being a high priority or outcome measure. You must report at least 20 cases for each measure and 70% of the applicable patients for each measure. If you do not meet case minimum, your measure will only receive 1 point, unless you are a small practice, and then you will receive 3 points. If data completeness is not met, the measure will receive 0 points, except small practices, again, will receive 3 points. Small practices, remember this is practices with 15 or fewer clinicians, also qualify to receive 6 bonus points in the quality category if they submit at least one measure. There are also a few other ways to earn bonus points towards your quality score. Measures submitted electronically will receive 1 point each up to 10% of your score. If you report an additional outcome or high priority measure, you will receive 2 and 1 bonus points respectively. These bonus points are also capped at 10% of your quality score. And finally, you can earn up to 10 percentage points for improvement of your quality score compared to your score from the prior year.
There are 3 new quality measures for 2020. The first is a measure for urologists, Measure 476, International Prostate Symptom Score, or American Urological Association Symptom Index, changed 6 to 12 months after diagnosis of benign prostatic hyperplasia. It is a patient-reported outcome high-priority measure. This is available through the ECQMs or EHRs only. It measures the percentage of patients with an office visit within the measurement period and with a new diagnosis of clinically significant benign prostatic hyperplasia who have International Prostate Symptom Score, IPSS, or American Urological Association, AUA Symptom Index, documented at the time of diagnosis and again 6 to 12 months later with an improvement of 3 points. The next measure that's new was developed for anesthesiologists. This is Measure 477, Multimodal Pain Management. It measures the percentage of patients ages 18 and older undergoing selected surgical procedures that were managed with multimodal pain medicine. This is a process measure, but it is high priority because it's opioid related. And it is available as a MIPS CQM measure only, so either a registry or a qualified clinical data registry. The final new measure is Measure 478, Functional Status Change for Patients with Neck Impairments. This is a patient-reported outcome, high-priority measure consisting of a patient-reported outcome of risk-adjusted change in functional status for patients aged 14 and up with neck impairments. This measure was developed for use by orthopedic surgeons, physical and occupational therapists, and chiropractors, although it may not apply to all clinicians within these specialties. And this is also a MIPS CQM measure for registry or qualified clinical data registry.
About 40 measures were removed from the 2020 performance year. Most of the removed measures are process measures, as CMS would like to focus more on measures that improve outcomes. A few key measures that were removed are Measure 91, Acute Otitis Externa Topical Therapy, Measure 109, Osteoarthritis Function and Pain Assessment, Measure 131, Pain Assessment and Follow-up, Measure 192, Cataracts Complications within 30 days following cataract surgery requiring additional surgical procedures, and Measure 371, Depression Utilization of the PHQ-9 tool.
So what should you be doing now? First of all, review the measures you reported for 2019. Check to see if any were removed or are topped out. You can still report topped out measures. Your score will just be limited. Also, look to see how you performed on the measures in 2019. If you had some low-scoring measures, come up with a process to improve your performance on these measures, or you may want to find different measures for which you could score higher. Look at the 3 measures that we just discussed. Do any apply to your practice? Make sure you're performing and documenting the measures now to ensure that you meet the 70% data completeness requirement to be scored for the full 10 points on each measure. Now, let's say you're submitting via claims. Make sure you look at your remittance advices or explanation of benefits for that N620 code to verify that your quality data code is valid. Remember, this doesn't mean that you submitted the code correctly or that you didn't have to submit additional codes for that measure. It just means that the code you did submit was valid. You want to review that measure specification sheet for each measure to make sure you're submitting the correct code for what you're trying to report. I had a client who was submitting only one of the 2 tobacco codes and wasn't doing it correctly. They had received the N620 for the correct code, but it wasn't every code that was needed to be submitted. So you just really want to make sure you're looking at those measure specification sheets. You can watch our webinar on submitting your 2020 quality measures using claims-based reporting for specifics on the claims measures. Now, if you are submitting via EHR, you want to make sure that you're also reviewing your quality reports from your EHR to monitor how you're performing on those measures and if you need to make any changes to your practice workflow to improve that performance. And we really recommend doing this early and often because we have seen many instances where the reports might not be working correctly or that they may not be documenting where they need to document, and so you're not getting the scores that you would like. So please pull those reports early and often. Now, here are some great resources for the quality category and general MIPS participation. Please feel free to reach out to Kelly or I if you have any questions. Here's our contact information.
Thanks again for watching our presentation. Don't forget to check out our presentations on the improvement activity, promoting interoperability, and cost categories also.